Preventable hospital errors are now the leading cause of death in America, only behind heart disease and cancer. And the problem's getting worse every year. Joining me now to talk about the problem is Dr. Tom Schneider. He's the author of the book, A Physician's Apology. Tom, the reports that are coming out don't speak well at all for the new invented corporate hospital. It used to be that we had doctor-owned hospital. They were independent hospitals. They could function in a way that was morally, socially responsible. Corporate hospitals are literally killing people. The last report that came out says it puts it somewhere around almost 3% fatalities in hospital stays now.
And I think that's low, Mike.
Yeah.
Based on my experiences. It's a frightening environment. You know, we've built a 747 with no wires to the ailerons, the rudders, the stick. There's no communication, no wiring. We've got an aircraft out of control.
Well, I think what's important about the study that came out of ProPublica was very important. First of all, they say that you have the American Hospital Association that has been selling the American public on the idea that there's only 98,000 fatalities a year. And then the newest study that has been verified and said absolutely it's accurate, absolutely it's right on the money, that number is actually 440,000. Let me say it again, 440,000 deaths. Now, what are the parts of this story that you think are important?
Well, one is the fact that at least it's coming out as a truthful phenomenon. But the numbers, Mike, being in the system as a physician, I can tell you they're skewed because there's such a requirement for physicians, for nurses, for hospital staff to close down on transparency. The public is not to know that. You know, Chevrolet doesn't want you to know that their tires are flat, and they're not. I'm just saying that. But do you understand what I'm saying? You need to keep this quiet. And that phenomenon is still extraordinarily present.
Well, what I read about it, Tom, and I've read your material on this in the past, it always nails it. And one thing that you talk about is the onset of the corporate hospital. The corporate hospital where we have fewer nurses working longer hours, so we're cutting the staff on nurses, we're making them work harder, and we're paying them less money. You're cutting corners on machines that you probably need, on number of beds that you probably need. You're cutting corners because the insurance companies are demanding that you cut corners. You have some cat with an MBA that wouldn't know what a damn biology book is, much less understand medicine, making decisions about what you can and can't do. And then you have the corporate hospital. The corporate hospital, like the type of thing that Rick Scott down here in Florida, where he raped the American public for what was $1.4 billion in fraud. Okay, but his hospital, you see, his organizations, they were interested in profit margins. They weren't interested in, are we taking care of the doctor, which they didn't do? Are we taking care of the staff, which they didn't do? And most importantly, were we taking care of the patient? You grew up and you have seen this firsthand, and I want to know how accurate that characterization is.
It's underutilized. I mean, it's far worse than that, Mike. I mean, I'm a physician, was in a hospital setting just 9 months ago, a local hospital here, with a severe illness, sepsis. I've been given, for example, insulin in the ICU that morning, and then was transferred onto the floor that night, and a nurse was going to give me the shot again. Fortunately, my son was with me, and who is a physician, and said, if you do that, I'm going to put you through the window. You're going to kill him. You will overdose him with insulin. No. And they battled and had to get the chief nurse in before they said, we're really, really sorry, Mr. Schneider, Dr. Schneider. And that really would have killed me. Now, that's me as a physician in a local hospital. Now, why is that? Because we had not a nurse, we had a 2 steps down giving me my injection who had messed up completely. And what were the head nurses doing? They're reamed with paperwork, legislative paperwork to do, not patient care.
Tom, let me tell you a story. I mean, there's so many stories. We could go on just with all these anecdotes, but I think this nails this story. Patient calls, says, you can't believe what I was just put through at a hospital. She goes in, they're doing a bone marrow test to find out whether cancer has moved into her bone marrow. They give her no sedative at all.
Right.
Zero sedative, and she goes through excruciating pain, virtually passes out from the pain, comes out of there and says, you know, every other time I've done this at other hospitals, they've given me Versed. They've given me something to where the pain wasn't so excruciating I thought it was going to kill me. They tell her there at this operation, well, our hospital doesn't allow us to spend money on that.
Yeah, see, what a cover-up. What a complete cover-up. And I'm going to kind of cut to the chase and say to you, that all needs to change. There's no question about it. And the emphasis has to be on the structure of the corporate hospital, which is so skewed. But I can't wait for that to happen 10 years down the line with legislation. I want the people listening to your show right now to realize you have to take responsibility for your health care. When you and I were kids, well, I'm a lot older, but when I was a kid, doctors were God. If they told you to take 2 teaspoons of this, you took it and you knew it was right. Today, you better darn well be aware of what that medicine is. I tell my patients, remember this mnemonic, QUEST. QUEST, Q-U-E-S-T. Q, question everything. Your lab results, if you don't hear about a result, you need to know about it. You understand every procedure, which side of the body it's going to be done on. You know, E, eliminate as many drugs and supplements as you possibly can. You had a great statement a few weeks back ago. You said, Tom, would you agree, don't take medications that haven't been out there for 5 to 10 years? Absolutely. You must have a proven track record and know why the medication's being given. S, submitting to tests. CT scans, MRIs, that's the name of the game right now. Recent study, 3,000 people undergoing CT scan of the lung, ruling out cancer of the lung. 31%, now that is not a small number. 31% were told you have the probability of a lung cancer. We're going to have to biopsy you. We're going to have to do an MRI. We're going to have to do this. We're going to have to do that. And they're wrong. Those are false positives. 31% were told wrongly you have the possibility of a cancer. And that's routine. That study's been repeated over and over again. The last thing, T, is please take charge of your health care. Do not count on the system helping you. Bring your best friend.
That is great. That's great advice. That's why we always have you on this show. Everybody wants you on their show for that reason. Let me back up and say where we are now. We start this analysis by saying 440,000 deaths a year. Now those are the new statistics.
Yep.
Nobody seriously questions those new statistics. As a matter of fact, most people say they're understated. But what's so ugly about this story is the hospital corporations are demanding that the American Hospital Association still go with the numbers of only 98,000 deaths a year. And I mean, to put this in perspective, this is an epidemic. I mean, is there any other way to describe this other than the healthcare epidemic?
No, and if you're a humanitarian, getting to the philosophy of this, if there were one death that was needless, careless, or erroneously occurred, if that's me or if that's you, it's horrific. But it doesn't matter if it's you or me. No matter who it is, the goal is to make that a zero tolerance. Zero tolerance.
What, doctor, in all years of experience, where do you find the biggest problem? What is the thing that's the gotcha most of the time for a patient? What is that gotcha moment?
I think there are multiples, but there have to be a couple on top. One is communication. The patients aren't told what's being done or why it's being done. And I mean that not just surgically, Mike. I mean you need to be on a statin drug to lower your cholesterol. Why, doctor? Why do I have to do that? What good is it going to do for me? What are the complications? Communication, communication, communication. And the biggest error, medications, without a doubt. So aside from just the biggest thing,
in a hospital setting, would that be the situation?
Hospital setting, 41%, the biggest error in medications, the wrong medication given. And, you know, just even verbally, the drugs sound the same. You know, I'm going to write for Diovan. Really? Only you've got Darvan. Darvan is a pain medicine. Diovan is an antihypertensive. but there are zillions of medications that sound alike. Those one error, eliminate that. It should all be done printed out. Handwritten, forget, that's all gone. So 41% of those in a hospital setting have been given some sort of erroneous medication.
Now, doctor, when I see the criticism, I mean, Hospital Corporation really is in charge. The new Hospital Corporation, I got about 30 seconds. They say that the fewer nurses, the longer hours, the cutting corners, the insurance company demands, the profit margin demands that the CEO is under, that all of those things are combining to create this very ugly picture that might be irreversible until we reverse the power of the corporate hospital.
I couldn't agree more. Absolutely.
How does it compare with what you grew up with in just maybe independent hospitals?
Well, the independent hospitals, you know, the emphasis was on the personal relationship of physician to patient. The nurse was there to establish that rapport and to continue the continuity of care afterwards. That's non-existent right now. Non-existent. A gastroenterologist is going to give you their medications. Your internist is going to give you his medications. The OB is going to give him. There's such a lack of connectivity, synchronicity that.
That's what the Hospital Corporation demands.
Absolutely. Absolutely.
Tom Schneider, Dr. Tom Schneider, very informative as usual. Thank you for joining me.
Love having it. Thanks, Mike.